For you and me, we are clearly able to express our healthcare needs. Good morning, Venkat. It's slightly different for a person with intellectual disability because they may not be able to express their needs. We need to be the advocates because we understand what it is to have a good healthcare. Nice.
Hello, doctor. Good morning.
Hello, good morning. Hi, Huda. Can check you easily. Wow, well done. Correct. Okay. Is it okay if I check you? I stand here, then you can do the same thing. Can you do once more? Very good. One more? Wow, well done. You've got good, healthy lungs. Good job. I think for you and me, when we actually approach a doctor, we are clearly able to express our healthcare needs. So the doctor is able to come to a conclusive diagnosis and able to treat. And Huda, is it okay for you to take out your shoes? It's slightly different for a person with intellectual disability because they may not be able to express their needs. They know they are in trouble, but they may not be able to express. And that becomes a challenge for a doctor because what does he go to fall back on to make a diagnosis? So communication skills becomes very relevant. And two is how you communicate with the person to make them feel as part of a decision-making process. When I examine an adult who has the cognitive abilities, it's very clear. I will just say, I'm just going to examine your eyes. I'm examining your throat. And the purpose of this is this. This one you know, right? Huda, no pain. Okay? See? It's slightly different for a person with intellectual disability because even if I say I'm examining your ears, the process becomes a daunting procedure because you're trying to put a scope into the ear. It may be a bit painful, but we are not able to clearly explain this to them. So very often, it takes time and patience to explain the procedure. Because if they have a negative experience for the first time, then I think it's going to be quite challenging to do the same procedure again.
I come here with my daughter, Nahuda binti Latif. She's 41 years old. From Dr. Bhavani only, I know that she's got diabetes. Dr. Bhavani is very special to me because she understands that Huda, she very soft-spoken.
You know what is healthy food, right?
Then Uda also like her much. Then Uda also feel very comfortable with her. Then when Dr. Bhavani asking something, right, Uda very good respond. After see Dr. Bhavani, I have strength and support from Minds Clinic that Huda can live as a normal person. And it's a relief for me as a single mother to get help.
Hello, good afternoon.
Good afternoon, Doctor. Good afternoon.
How are you?
Fine, thanks for coming.
Good afternoon. Don't worry. Doctor only talked to you. Okay? Can raise your hand? Wow. Very often we are called to make home visits. Partly because they have physical disability or they actually have behaviors which are quite difficult that they can't manage, or the caregivers themselves are very elderly. What happens is when we compress, right, it feels quite tight. So I think she's beginning to feel that.
My sister is very particular of herself, protective of herself, because she doesn't like to be touched and all that by because blood pressure machines and all. She had bad experience in the hospitals. If she gets too excited and she starts shouting, and it has disturbed the other patients. We were much happier that the doctor is coming here.
You relax. When the Minds Clinic started, we were a bit of a solo practice, but we very quickly realized that without partners who have similar mindset, there'd be no way we can progress forward.
Okay, so at least a few years, Harjinder hasn't been back to the same dentist.
The big service gap we found was the poor dental care that most of the persons with intellectual disability had. And we found Dr. David, who was actually specialized in special needs, and he strongly believes in equal health care, and he's been helping us.
Oh, a bit sensitive, right? Okay, let me shift back teeth, huh? Oh, okay, let's take a break from there. I think this is quite a heartening field of dentistry. You get to grow, not just in your techniques, but also as a person, the way you view life, and the way you provide for society. The dental needs for persons with intellectual and developmental disability is very, very big. It's disproportionate as compared to the rest of the population, and we have more than enough screening data to substantiate this claim. Dentistry is a very dependent on our equipments because we are doing procedures, fillings, you need this and that. So you have to plan for the treatment ahead, plan what you want to bring. It's difficult to work at home is because the patient is not on the dental chair. So with a dental chair, we can work more ergonomically around the patient. Yeah, we need a small mirror. But sometimes if the patient is lying on the floor or lying on the sofa, it's not at the ideal level. So we have to bend down a lot or we have to kneel down. And if it takes very long, it's quite bad for our back and legs. So for that, I have to do strengthening exercises every day just to keep up, to make sure I'm physically fit for some of the procedures. But you've done really well, huh? We checked every teeth, we make sure every surface is clean.
Hello, can we come in? Dr. Bhavani and team here. Look at Bibi, make sure she's okay today. Come. Thanks. Some of the persons whom we are actually going to examine may not actually want to be examined. So they are actually within a bedroom setting and they don't want to come out. So we have to make ways and means in which we see the person and provide them the appropriate care. Sometimes we face some challenges with regards to behavior, but I think over time we have actually understood how we can approach these issues. But by and large, we've actually been pretty successful in a home care setting where I think the person itself is more comfortable. Hello, good morning, Venkat. What about feeding?
Feeding also.
Also needs complete
assistant. Yeah.
Needs assistant. We are at the Minesville Residential Home, and this is an adult disability home which houses persons with intellectual disabilities. A number of them actually have mobility issues. They are wheelchair dependent or they are very frail. There we go. Well done. But we were very fortunate. We've got 2 nurses now who have very similar mindset and they fight for the advocacy of healthcare for persons with intellectual disabilities.
Hello, my role here is actually to take the blood test to check for patients' HbA1c, which is their sugar levels and also their cholesterol levels. With this, we could detect if our patients are having any elevated levels of cholesterol or sugar levels. I will alert it to doctor. From there, doctor will then do a referral, if needed, to polyclinics to follow up for our patients. The most difficult thing about my job in Mines Clinic is communication barriers. Because many persons with intellectual disabilities have difficulty in verbal communications. So this makes it difficult for me to understand their needs, pain levels, or emotional states. Nurses caring for persons with intellectual disability are highly attuned to facial expressions and body language. This helps us to understand what they are feeling or their needs. His cholesterol is normal?
No.
Oh.
I think Balbi saw basically 2022.
Working with Dr. Bhavani is very eye-opening because she is a very dedicated and compassionate doctor who prioritizes our patients and often give extensive time and effort to ensure that care is given to our patients.
Let me come at the back. currently, when the caregivers are aged and the siblings don't have the capacity to look after, we do have to actually refer them to the adult disability homes. I don't think this is a long-term solution, partly because people with intellectual disability are living longer. So how many homes can we actually then have in order to sustain this model? So integrating them into the community, providing appropriate preventative health care will go a long way to actually facilitate this concern. Quilting is a hobby and I love it. I think the nature of the quilting is that it does require a lot of time and it requires patience. So that actually kind of correlates with the work I do. I need the time and the patience to examine persons with intellectual disability. There's also something very good about quilting is that you recognize patterns, you break down complex issues into simpler issues. And that's what happens when you actually deal with persons with intellectual disabilities. Not all of it is just healthcare. We understand that there are the social barriers, mental, emotional, and we need to break them down in order to provide equal healthcare as well as good quality of life.
There are so many ways in which what she loves about quilting mirror who she is, and she's currently finishing up the second quilt for my 3-year-old. It's really layered, just like my mum. My mum is very much of a planner. She's someone that looks ahead and thinks about what the longer-term picture is. Sana, what are you doing?
I think you both are in the sky.
But I think the truly extraordinary thing about her is how she cares so much about people, and she selflessly dedicates herself to whatever she can do to make things better for other people. That's true of us at home, and I think that's true with the work she does.
When I worked in KK Hospital, I always kind of had an interest in disability work, and I had started the Down syndrome clinic in KK hospital settings. So children were actually growing to become adults, and many of the parents would then turn around and ask me, what do we do now? You're going to discharge us from KK hospital. Where do we go for this kind of support? Who is the go-to person now? And that kind of made me think, we need to start a clinic of this nature to continue and provide a lifespan approach for persons with intellectual disabilities.
Good job. One more. Good job. Yeah.
Can I put here?
Having inherited this clinic from Dr. Bhavani, initially I was very overwhelmed.
Do you use toothpaste?
Patients had a lot of medical conditions, social issues. Some of them were already 30 years old plus.
Inside your tummy got what?
What Dr. Bhavani taught us was that no matter how difficult the problem is or no matter how difficult the patient is, it's always good to make sure you cover all your bases when you're talking to the patients.
For the school IQ assessment, does he need any letters?
We took time to understand each patient that we saw. He's been eating and drinking, okay?
Okay.
All right.
It depends on his mood. That one it depends on his.
Okay. That helped us to slowly build up and enhance the clinic to make it very comprehensive.
Okay. Ken, Saifullah? Yes? Are you happy?
To scale the work that we have done, we have published clinical guidelines for management of children with Down syndrome. And this helps other doctors to run the clinics during our absence.
When we start the clinic, we always wanted to continue, and we want people who take over to run it passionately and also develop it to the next heights. And I think that's what I'm seeing now. Having met both of them, they've actually highlighted some of the areas that they have kind of worked on, and having clear plans about what they want to do for the future for this clinic, I think that's extremely rewarding.
Lim Jenny, 号码在这边。名字在这边。Assisting patients to the polyclinic, it's really on case-to-case basis. We will actually assist those clients that have elderly caregiver where bringing them to the polyclinic or just stepping out of the house is really impossible. We also understand that during procedures like blood taking, the caregiver may not be able to hold down the client to get a successful blood taken. The challenges faced at the polyclinic is mainly because it's a very open area, it's a public area, where because of the movement and the sound around will actually make our clients more anxious. And that's where the behavior and the meltdown will happen. And some of the clients, when they are actually anxious, they will run away. So I have to really play along and then catch them back or really calm them down. Before I bring these patients out, I will actually assess them first, understand their behavior. So in case if there's a meltdown or anything, I know what they like, what I can bribe them with and calm them down.
检查，不会怕啦，来看一下，一下，一下，一下。OK， 你不要看，我这样过你。
The long-term goal with regards to providing equal health care for persons with intellectual disability will involve us in integrating with the current healthcare system with GPs and polyclinics.
This is where we send our patients for phlebotomy. So usually somebody will accompany and be registered over here.
Okay. Dr. Alicia Bo has been instrumental in helping us with the polyclinic arrangements because we have actually formed partnerships in the community with different polyclinics in order to help persons with intellectual disability attend the healthcare settings.
In terms of pharmacy, they also allocate more time with the patients. We preempt our pharmacies about them. Mine's clinic is just down at Farrer Road, so we are the nearest polyclinic. And after getting to know her work and the people that she serves, I thought that, yeah, it would be good to collaborate with her to make sure patients get the care that they need. There is a gap in services for patients aged above 18 if they have IQ issues and mental disabilities. And they are really quite an underserved population. But what we do is to make sure that they are given a longer time and their itinerary is pre-planned for them in advance before they even touch base at the polyclinics. And they are also equipped with communication aids to help communicate with the patients with intellectual disabilities as well. And in terms of consultation time, we have lengthened it to accommodate these patients.
So I explain in details what are the benefits government will give you once you enroll.
I think this is the model we hope to achieve in future where we can link up with all the polyclinics and continue to serve this population. It's the same with the clinic when they
So they are actually within this catchment. What we've done is really to focus on pre-visit preparation. We work closely with minds as well as the patient's caregivers to prepare them ahead for their visit so that they understand what to expect when they come into the polyclinic. So these are resources that we will share with the caregivers. So what this means is that they know what the patient journey would be like from the time they enter the polyclinic to the time they see the doctor, and maybe even to some of the services that they may need to go to after the consultation. We're not just providing healthcare, we are building an inclusive society together. I think crucially, it is also a big reassurance for caregivers. Many of the caregivers of individuals with intellectual disabilities are already elderly and they do have their own health concerns. knowing that their adult children with intellectual disabilities and other forms of disabilities can access healthcare independently. They are able to do so within a system that is friendly and accommodating to their needs. And I think that is the most important work. Okay.
This is one of our dreams. We want to extend healthcare provision at the community setting. So though it is a small scaling up, we are very pleased to see that this has been successful models, and we're hoping that it'll be a similar model in other polyclinics in future.
High five, man. Well done.
I really don't think there's anything extraordinary about this work. I do think this is the goal of every healthcare professional, that we actually understand vulnerable population. We need to be the advocates because we understand what it is to have a good healthcare.
I've seen her work through many stages, through a lot of difficulties and a lot of challenges to come to this stage where we have already a clinic with a medical arm and a dental arm. And it's not just an inspiration to know somebody who does this, but to know her personally and seen all the hard work through so many years.
Does she normally sleep here though? She will sit here.
It's been a privilege for me because if not for her, I will not be able to understand this sector where there's so many vulnerables, people with intellectual disability that are actually unnoticed, and they are not given the balance or the fair medical treatment that we all supposed to have.
Being a doctor looking after persons with intellectual disabilities has been extremely rewarding because both families as well as the persons with intellectual disabilities themselves actually think you're their support. You help them through their life, and they call you for help. They feel somebody is there to listen to them, and I think that's what I feel I've been able to achieve during this period.
Just when I was wondering who would turn the gray sky